Welcome back. There is a new healthcare model open in Quincy Center called Gather Health, aimed specifically at older adults. One of the co-founders, Dr. John Linnane, is here this morning to tell us how it all came about. Doctor, thanks for coming over. Really appreciate it.
We really appreciate the opportunity. It came about in a number of ways. One was truly my experience here in Quincy.
Yes, tell us about you first before we talk about Gather.
Yeah, so I had worked at Manor Community Health Center as a primary care provider and spent time at the old Quincy Medical Center taking care of people in the hospital. And I actually transitioned to be a hospitalist and then chief of hospitalist at Quincy Medical Center.
An award-winning chief of hospitalist.
Yeah, thank you. But the two things that struck me there was, one is how much I enjoyed taking care of people in Quincy and at Quincy Medical Center. And I often say if Quincy Medical Center was still here, I would still be there.
Is that right?
Yeah. I loved it, as often people did. And what really struck me is I took care of so many folks who were older. And I had so many times when people would say I was born at Quincy, and they'd have medical issues when we talk about options, and they wanted to stay in Quincy. Boston was just 7 miles down the road to some of the world-renowned hospitals. They wanted to be there. They loved their community. They understood the care we were giving, and they felt like that we met their needs. In some ways, if they went into Boston, they were far away from home. They couldn't be visited by friends. There was a real social component to that.
It's a big hurdle, isn't it, to get Quincy to Boston for a lot of folks? It's just there's a hurdle that they can't overcome.
Absolutely, and I think the hurdle is much about social isolation and being away from their loved ones. The other thing that always struck me at Quincy Medical is how many people visited. Out of all the hospitals I've worked at and been involved in, both in my residency at medical school in Worcester and in residence in Seattle, Quincy was the place where I saw the most people visiting. And I think that meant a lot to people. That aspect of things. So that experience of Quincy really cemented in my mind the community, and also it's an older population. There I took care of the vast majority of people who are older, and I really enjoyed that. I enjoyed the intersection between the aging process, decisions made around healthcare, where maybe what you would have done at 21 is not what you do at 81. And I just wanted to be part of those conversations on a regular basis, which was sort of the first part of Gather Health's story, was that engagement and really learning from that experience, taking care of people.
Okay, so this is kind of, as I mentioned, it's kind of a new model, right? It's more of a holistic approach to more keeping people healthy than treating them when they get sick, right?
It is, and some of that arose from my past experience. I had been in an entity called Commonwealth Care Alliance, which is known, it was once first called the Social ACO, that was really focused on keeping people healthy at home and avoiding unneeded EDs and hospitalizations. And I was chief medical officer there for a number of years and did a lot of the care there, including having our community paramedic program. And I really saw that, in essence, going to the hospital is never an easy decision. It also, as we get older and such, it is a decision that has a lot of downside to it. Hospitals are tough places. People who go into the hospitals when you need to, and absolutely that has to happen. But when they come out, often it is an issue where they're more deconditioned, or they've picked up something in a hospital.
Right, yeah.
And so whatever we can do is we have two basic rules. One, if you need to go to the hospital, we want to get you there fast. Early identification of issues so you can get out of there more quickly. And second, if we can avoid a default, i.e. the ED is the only solution, and that's really what we're focused on, is figuring out how do we avoid the ED by, one, great primary care, and second, responding to acute needs in a timely and effective fashion.
Sure. So who is Gather Health, Doctor? I mentioned you're a co-founder.
I am. Yeah. So Gather Health is really, I think, a collection of people who have been in the healthcare world for quite some time. Our CEO is actually an ED doctor. Why does an ED doctor think about primary care? Because he's been in the ED for a lot of years, thinking like, why couldn't this gone to primary care?
Interesting.
Or how do I get this back to primary care so I don't have to admit the person? So the CEO is another physician ED, Brent Asplin, who understands the need for this. The rest of the team is really focused on three roles, and I'll talk a little bit how we really saw this. And the other part of the Gather story is during the COVID pandemic, I actually spent time as what's called an end-of-life doula. Doulas are a different concept. In essence, doulas are a mirror for people. So it's an open-ended, open-hearted conversation to go in times where people are experiencing medical care but need a lot of human support. So the two most known doula structures are birth doulas. Birth
Yes.
doulas are by far the most,
Yeah.
but there's been a growing world of end-of-life
I've
doulas.
not heard of that. Okay.
So how-
we only hear about hospice at end of life.
Right, you
Yeah.
do. And again, end-of-life doulas fit this unique role where it's all about a non-medical model.
Okay.
So I was in homes, even though I have a medical background, I actually am board certified in family practice and hospice and palliative care. I had done a lot of hospice and palliative care. It was a very different role. I would go into homes during the pandemic and support people around the human experience of end of life or the human experience of serious illness. And the two things I took away from that was this huge need for primary care that could be both in the home and also in clinic. And the second thing I took away, as I always do, is just the social experience of being sick, of being older, of the isolation, of the fear, of the anxiety, of how things are so much harder. And as a doula, those are the things you talk about. You know, that really translated into Gather. We see you as a person first and a patient second.
Yeah.
The first thing you do at Gather when you come in to see us is meet our Gather Guide partner. One of the Gather Guide partners when I'm in the room is they describe themselves as your best friend or
Okay.
your niece or your nephew who you count on. And the first thing we do is something called the Tree of Life. And the Tree of Life is to ask you about your life. I don't want to know about your diseases. I don't want to know about your medications. At first, I want to know about who you are because everything has to be in that context.
Yeah, but you can't do that in 10 minutes, doctor. You know?
No, we don't. So the way we
Right.
have set it up
And I'm
is
saying that facetiously. Because, yeah,
absolutely.
that's a typical primary care visit, right?
It is.
10, 12 minutes, yeah.
And so the way we have structured this is in this way. There's 3 members of the direct care team. There's the Gather Guide partner who is based on this doula concept of an open heart, an open mind, and really there to figure out who you are and how we can help you. They talk about things about your past experiences, the challenges you face, whether it be transportation, loneliness, isolation, family dynamics. So they're the first person who sees you. That first appointment is usually an hour. The first half an hour is with the Gather Guide partner. And then your primary care provider, someone like me,
Yes, yeah.
will come in and talk about the medical issues.
Right.
In some ways, that's sometimes less fun than being the Gather Guide partner. But that's about the things. What do we need to solve right now? What chronic medical issues, what medications and such. And that really is our first appointment, which is booked for about an hour or so as we see you. After that, we have a roll call of medical technician partners, which are folks who actually go to your home and are protocolized to look at things like, is there enough food? Are there safety issues in terms of bathrooms, showers? Are there fall risk? Those type of things. And they also go and put technology in your home. We use a lot of remote monitoring to look at your blood pressure, to look at your blood glucoses. We use different technology devices also to help you connect to us through virtual visits. So after that first visit in the clinic, we then have our medical technician partner kind of go to home. And at the end of that visit, you connect back to your primary care partner.
Okay.
And that's what we do. And then roughly after we've collected all that data, we have what we call initial gathering 2, roughly a month after that, where we've had a chance to review all your records. We've had a home visit. The Gather Guide and the PCP really sit down with you and say, oh, I've been able to review all the records you've had, and then we go much more into the medical model.
Okay.
At that point, we then decide how much further, how many visits and how often we need to see you.
Yeah. How many doctors currently in the practice?
So right now we have myself as a physician and we have 2 nurse practitioners, but we're growing all the time and
Yeah.
adding individuals.
Okay, it's kind of, we've seen some of the bigger agencies advertising, heavily now in this new kind of older healthcare model. Is it based on something? Is it based on?
I think it's based on a lot of experiences, as I said. It's based on a lot of what I had done in my career throughout seeing primary care. I've had an interesting career, rural family medicine in Vermont, being trained in Seattle, working here in Quincy in different entities. So it's based on our experiences doing this. I was looking back at a lot of my past records, and I kind of keep track of everything. I'm probably up to about 20,000 patients now that I've seen.
Seriously?
And the vast majority of them have been older in nature.
Yeah.
And so that's where I'm really thinking about, how that is. As you can see, my hair is graying. I experienced the care of my parents as they aged, and I just see there's a unique need to identify those who are older, to really be cared for in a different way.
So who can be a Gather patient?
So if you have Medicare. So
Okay.
basically we really have focused on Medicare.
So 65 and older?
Yeah, 65 and older, and some individuals who may have Medicare in different ways.
Oh, for a disability or something?
Sure.
Okay,
We
yeah.
really are focused on the Medicare population. Part of that is we also do a lot of social events.
Yes, you have your senior prom. I know
We
you
had our
not too
senior
long
prom,
ago,
the
yeah.
Winterfest.
Actually, just earlier this week you had an event
Yeah,
up at the
it's-
Terrell Room, yeah.
And again, that's to have people see themselves as healthy individuals
Yeah.
and not as patients with a list of medications. Yesterday I did chair yoga in our own facility. We
Yeah.
have different activities. So we also wanted to have peer activities. We think sometimes the best medicine is peer-to-peer discussions. And that is why. So we hold almost daily activities at our site here in Parking Way, where people will do crafting, they do cards, we do walking, we do yoga.
So this is much more than a doctor's office.
We want it to be experience.
Yeah.
Again, we want to share health.
Yes.
And again, it's so important for us, for our patients, to see themselves as healthy people who may be having medical challenges and not as patients who don't see health in their future.
Yeah, well, I know a couple of Gather patients, and they are extremely pleased with the experience
Good.
compared to their past primary care experience. Do you take care of folks who want to switch, basically, and come
We
to
do,
Gather?
absolutely. And again, the other thing I want to say is there's great medical care here in Quincy. In no way is this to say that there isn't great doctors and nurse practitioners.
Yeah.
We absolutely believe there are. We think there just is a different need at times that we fill. So we're always happy to talk to anyone who would like to be part of our practice on a regular basis. The other thing I'll say too is that a lot of times patients like, I'm not there right now, and the clinic's open. And our Gather Guide partners and our medical technician partners are seeing people all the time.
Right.
So it isn't just you have to have only PCP care. The care is shared. And I think as I go through my career, I realize that having a PCP is really important, but there's so much more.
Yeah.
And that's really where we have been focused.
Do you have all the basic lab testing,
We do,
X-rays,
absolutely.
things like that?
We absolutely do. We do not have X-ray currently.
Okay.
Over time, we will add X-ray,
Okay.
but we have all the lab work we do. We have the vaccinations. We have a lot of point of care testing, so we can test for diabetes and let you know exactly what that is in the office and those type of things.
Okay.
And as we grow, we'll add those other modalities there. We have good relationships with everybody in the community, so if we need to have a subspecialist or get X-rays or CAT scans, we ask people where they want to go,
Okay.
and then figure out how do we make that most efficiently happen.
Okay, and I know transportation can be provided.
We
as well,
actually
right?
do offer transportation,
Yeah,
yes.
that's huge.
For appointments, we
Yeah.
will do transportation to get you to and from the clinic.
Yeah, and the virtual aspect you said is here to stay, right?
It is,
Yeah.
and we're excited because we think one of the misconceptions is folks who are older don't want to use technology, and I think that's just not correct. And so we'll work with you. Again, our Gather Guide partners, our medical technician partners know the technology we use really well, and will help anybody learn how to do that.
Okay. You mentioned you just opened on Parking Way, but you
Yeah.
had an office prior, right, over East Quantum Street?
We were in Squantum, yeah. We wanted to start.
Okay.
Again, we really love the Parking Way location, but we didn't want to, we thought we had something to offer.
Yep.
So we wanted to start early, so we opened Squantum with 2 exam rooms.
Okay.
It looked like the old days of 1950s general practitioners.
Right, yeah.
It was a great space. We did a lot with it. But we wanted to be in the heart of Quincy. We wanted to be downtown with a much larger space so that we could have more rooms, serve more individuals, and most importantly, have that common community space.
Yeah, yeah. Will there be future Gather locations?
There are. We were
Really?
thinking about where does this go next.
Really?
We want to go where the need is, so we're looking for areas around Boston. Hopefully, we'd like to be, in other states.
Okay. Wow.
I think again we're very lucky here in a lot of ways in Massachusetts about our healthcare. There are places that I've been to in the United States that aren't quite as fortunate.
Right.
So again, we really started this in Quincy. This is a born in Quincy to figure out how do we do this to get this need for those who this may serve.
Yeah. Do you need more physicians in your practice?
We do. We want like-minded people to join us.
Okay.
We want this to be an opportunity that is for anyone who thinks like healthcare needs to be a little different, and healthcare needs to be really focused on the individual needs of our older citizens.
Can you talk just a little bit about the funding model for Gather Health, how it was founded and how it sustains itself?
Yeah, it does. So where we are right now is we are funded, again, this is backed by a number of venture capital entities because we wanted to be able to offer services and also have the ability to expand.
Yes.
So as we, as been in the newspapers, we were venture backed, but that is how we think about creating the practice. We take all insurances. One of the things we also pride ourselves on is that the insurances were very knowledgeable about insurances. We have someone in the office who can work with patients with insurances
Yes.
to figure out what's the best fit for them.
Okay.
We don't have any preferences, of course, because that's not our role.
Yes.
But we can kind of review people's policies and see what their needs are.
Okay.
So often I will come out of a visit and say to our insurance specialist, hey, listen, they really need more help around prescription copays, or they need more help about home health, or they need help around a specific issue.
Yeah.
And then our insurance person can then identify what might work for them, and then if that is appropriate, then we refer them to brokers and others to really go into the nitty-gritties about what that would be.
Okay.
But we do think how healthcare is funded is vitally important to us.
Yeah, well, Medicare reimbursements, as you know, is a question, that's been raised.
It always is.
Yeah.
And again, in the end, we really are focused on finding the best payment method to support people at home.
Okay.
So that's what we're also doing. I do come from a world for 12 years for
better
for
than anyone,
Medicare
yeah.
Advantage dual eligible special needs plan here in
Yeah.
Massachusetts with senior care options and the under 65.
Yes.
I know how important it is to have the right insurance.
Okay.
I know that as a patient. I know that as a provider. I know that as a family member,
Right.
taking care of my parents. So I think that's a crucial component that will help people. We can have the best medical plan in the world. We can have the best social plan. We need to be able to support that with the right payment method to do that. And
Yeah.
that's part of Gather's value, is to think about how do we do that together.
Can you tell me what the name Gather Health?
Oh, absolutely.
Yeah.
We want to gather.
Ah,
So we
okay.
basically think there's power in community. There's power in gathering together as a community, as a patient community, as a provider community. There's nothing better than I like than seeing what the Winterfest is with people dancing.
Yeah.
There's nothing better than I like to sit in a room and do chair yoga with people.
Okay.
We too are people. We're just not the providers you see. We want to be part of what your life is. Also, it just gives a whole different vision of how people think about things,
Yes.
and I think that's a crucial element.
Interesting. Now, at Gather, are you sensitive to the multicultural aspect
Absolutely.
of the city?
Yeah, absolutely. Yeah, we have ability through translation lines and language capabilities throughout, and that's most important. That's honestly why we ask the Tree of Life too. We make no assumptions. We want to have the person tell their story so that we understand how best to serve them,
Yeah.
to best engage, that they determine. I often tell my patients, I make suggestions, they make decisions.
Ah, very good.
And
Yeah.
that's what's important, is that this is a conversation and a dialogue, and I think most folks will find this to be very non-hierarchical.
Yeah, it's a very customized plan for each individual, it sounds
We
like.
really do. It's an individualized social, medical, and how you engage with us.
Sure. How many patients right now do you have?
We're heading into the hundreds. Yeah, no, we're in the hundreds. Yeah,
And
absolutely.
so you're accepting patients?
We are, absolutely. And again, the other thing too is we'll accept patients. If you call us on one day, we'll probably be able to see you the next day or shortly after. So
Wow.
we have really good availability, and we pride ourselves. We keep a lot of open appointments to do that.
Okay.
And as I go back here, we're seeing patients I called this morning.
Oh,
and I'll
wow.
go back and see them this afternoon. So we have lots of availability to do that.
All right. Anything else you'd like to let folks know about right now?
You know, I think we want to partner. I say this all the time, but as I get older, and I use the medical system, I want someone who really understands me as a person and values me as a person, that understands what my goals are, that doesn't just see me as someone who is aging, who has now white hair. I want to be seen as someone who has a really bright future, who has potential, whose life is maybe a little bit harder because of these challenges, but has just so much opportunity to have a great 20, 30 years. And that's really our key. We really want people to understand that our goal is to make sure that their health care is met so they can live their lives as they define it and as they really want to spend their time. And we want to support that.
Well, appreciate the opportunity to meet you and learn about Gather, and hopefully we've got the word out for you.
I appreciate it also. And again, we would love to see people at the clinic, and just give us a call.
All right. Thanks again, Doc.
Thank you. I appreciate it.
You're very welcome.